Hello, Akshaya. Good morning. You can unmute if you want. Good morning, Akshaya. So you can share your problems regarding reading. You can share your problems regarding reading skill. Which part is difficult for you? Can you hear me? Yes. Yeah. Hello, Damayanti. Hello, Damayanti. Share your concerns regarding reading.
Good morning, sir.
Good morning, Damayanti. How are you?
I am okay, sir. And you?
Yeah, I'm fine. I'm excellent. Yeah. Share your problems regarding your reading.
Um, okay, sir.
So, which areas you are facing difficulty?
Especially C parts, sir.
Hmm.
But I take your guidance through the videos.
Hmm.
So after that, I am getting better, sir.
There is improvement.
Yes,
Very,
sir.
very good. Very good. We are getting excellent results. You see, right?
Yes, sir. Earlier listening also same, sir. Listening BC, I am getting very low mark.
Hmm.
But after following your videos, now I can get more marks for BC.
Wow, that's good. That's really good.
Yeah.
Hmm. So, now today I'm taking reading. Okay. Tomorrow I'll take listening. All right. We'll see accordingly. So, what do you want me to take today? Reading part A or part B or part C? You can suggest because you are my regular student. You can
I,
suggest what exactly you want.
if you are comfortable, it C is better, sir. BC.
Yeah,
B.
B or C. I'm comfortable always. You tell me what you want, B or C. Choice is yours.
uh, B is good, sir. I follow
B,
the C.
B is good. Okay, fine. So that's it. Let us lock a B. So we'll take a B part today, right? Okay, part
Okay, sir,
B.
thank you.
Right. Yeah. Today we have a guest, Akshaya. Hello, Akshaya. Are you comfortable? You can share your experience. Which part of a B you have problem with? So you can share your points. If you are comfortable, you can discuss your problems. Yeah. So otherwise, you can even message in the chat box. Right. Yeah, this is a full day link. Yeah, Akshay, sir, I'm on duty. I'm unable to speak right now. Part C is difficult for me. Okay, sir. No problem. Yeah, we are going to take part B. We are going to take part C. Yeah. Damayanti, do you have any specific test or do you want me to test select the text myself? You can, okay, you can just let me know or I will choose my own text. So, Rinsi. Yeah. So this PC, D drive. So let us take MRSA. MRSA. MRSA speaking. No. MRSA reading. Question paper and response key. Yeah. Question paper and response key. Right. Okay. This is MRSA. So we are going to take this question. Part B. So don't be in a hurry because my teaching style is a little different. For new students, I'm telling. So be patient enough. Okay, don't be in a hurry. So print screen. Yeah, file rectangle. MRSA. Reading. Reading subtest. Part B. Yeah, yeah. Boomerang series. Reading subtest. Part B. Reading subtest. Yeah, yeah. We are going to do reading. Part B. Reading. Part B. Yeah. Reading part B. Okay. Boomerang series. Part B. Reading subtest. Yeah, that's fine. So all of you can message what type of difficulties you are facing, what exactly are your problems, why this confusion. So you can just message me. Yeah, part B. Yeah. Hmm. Oh, yeah. This is our question. Yes. Full screen. Yeah. Bear with me for a few seconds. So we are going to do this complete set. Yeah. So this is our test for the day. Yeah. So this is the question. Okay, this is the question. Okay. And yeah. Yeah. So we are going to play the first question. Yeah. So this is our first question. MRSA. Yeah. So time starts now. 2 minutes. Sixty seconds more. Yes, time up. Submit your answers, please. Submit your answers, please. A, B, or C. So question number, yeah, Boomerang 1. A, Boomerang 1. So A, B, or C. A, B, or C. So give your answers. Yeah, A, B, or C. Yeah. Now let us check the answers. Now check the answers. Okay. So this is the first question, right? Question number 1. Yeah. Full screen. Yeah. This is Boomerang 01. Yeah. Now let's check the options. What is your answer? You have given A or B or C. Okay, now let us go there. Okay. So 15. Yes. So B, reading part B, 1 is have it done on site. Have it done on site. You have given B and C. You have given B and C. Okay. Yeah. So have it done on site. Have it done on site. So let us check if we have done this already. MRSA. We have already done it. Part A. Okay. MRSA part A. Okay. Right. Part B. So now can any one of you share your opinion why you thought it is B and why you thought it is C so that we can discuss this. Okay. Right. According to the memo, sorry, hide. According to the memo, staff requiring a free flu vaccination must. Okay. According to the memo, staff requiring a free flu vaccination must. What must they do? Okay. What must they do? All right. You have given B, you have given C, but the answer is A. Okay. The answer is A. Why it is A? We'll see that now. Okay. So the answer A, B, C. Okay. Logical reasoning approach. Okay, the answer is A, as we have seen. So copy post a link. Okay, the way how you are going to attend these questions is like this. Okay. So now I'll give you the link. You can go there and submit your answer A, B, or C, whatever you have done, that only you submit. No problem if it is wrong. There's no problem if it is wrong. Now we have to see why this is right and why this is wrong. Yeah. Now let us discuss this one. Yeah. Now let us discuss this particular question here. Yeah. According to the memo, staff requiring a flu vaccine. According to the memo, staff requiring a flu vaccine. Okay. According to the memo, staff requiring a flu vaccine. Okay. So it's very clear here. According to the memo, this is the memo. According to the memo. According to the memo. So you see, this is the memo. So this is the full thing of memo. Right? Fine. According to this memo, okay. According to the memo, staff so it is written to the staff. It is written to the staff. It is written to the staff. Oh, it is written to the staff. So staff. Okay. Staff. Now, second thing is pre-flu vaccination. So it is flu vaccination. This is everything is regarding flu vaccination. So this is flu vaccination. This is regarding flu vaccination. Okay, flu vaccination is there. Now they must do something. So requiring staff who requires a free flu vaccination, we know free. We want a free. We want free. So there means this shows that there may be free and paid. There may be free and paid vaccination. What is free vaccination and what if not free vaccination? Okay. What is free vaccination and what is not a free vaccination? Now you have to see the offer of a free of charge. So here you see the free of charge. Yeah, here it is there, free. So this is related to free. You should remember that. It's a free of charge. Okay, free of charge. The following arrangements have been put in place in order to maximize uptake. So arrangements. So arrangements. So what are the requirements? That means they have the following arrangements. Arrangements means requirements. Yeah. Yeah. So now you can see here very carefully. So now if it is not free, then what? Staff may also, so here it is. This is paid one. So staff may also attend a community high street pharmacy to get the flu vaccine privately or personally. This is privately or personally. So, however, be a charge. There will be a charge. So this is not free. This is charged. This is charged. There is a charge for this one. There is a charge. So that is why this is eliminated. This is eliminated. This is eliminated. You can see here. Oh, oh. Yeah, this is eliminated. You can see this is eliminated now. We don't need all these things. Okay. We don't need all these things. This is eliminated. This is not required for us because this is regarding not free. So whenever you say free, that means paid also is there. Okay, paid also is there. So we are eliminating the paid. How to find the answer? I'm telling you, it may be, if you can try to analyze, it will take no more time now to learn, but if you do it personally, it will be very simply, because I'm explaining, you'll take time. So here, so requirements means arrangements, requirements and arrangements, obligations, options, all these things. Now you see free is still here. The last one is paid. Okay, the last one is paid. Now let us take this into consideration. Okay, this is a memo. Okay, this is a memo, and this is a memo to all the staff. All the staff. Okay, regarding staff flu vaccination program. Okay, requiring means arrangements. Sorry, requiring means arrangements. Oh, okay, free flu vaccination must. So try to understand this one. Okay, so here you should see very clearly now. Now, first one is have it done on site, respond electronically, be above a certain age. So try to observe this one. Mass vaccination clinics have now ended. Please contact occupational health to arrange an appointment. An online appointment, an online form which has been sent to your email inbox must be completed. First one is they must complete and submitted beforehand, before vaccination. This means you have been, this will generate a reference number. So first you will be, this is the first step. This is the first step. What is the first step? Now let us see that. What is the first step? First step is, so an online form. Uh, an online form must be completed. So this is what you have thought. So respond electronically, you thought. But this is the first step, na? This is the first step. Then this will generate a reference number. Okay, which must be noted and brought to your appointment. So first one, actually first one is you should arrange an appointment. You should arrange an appointment. And next you should apply an online form. And then you will get a reference number. You will get a reference number. Then this reference number must be noted down. This reference number must be noted down and brought to your appointment. You should also must bring this reference number to the appointment. Staff working in community settings or who are unable to attend an appointment due to shift rotations should contact peer immunization. Okay, peer means same group. Okay, same group. So those who are staff working in community settings or who are unable to attend an appointment due to shift rotations. Okay, this is what it is. Should contact peer immunization. So they must contact peer immunization. Okay, peer immunization. And the above information applies to staff aged 18 and over only. All this is related to staff above 18 and over only. 18 and above only. 18 and above only. So try to understand here very carefully. So first thing is, then what about below 18? Below 18, that is 17 or younger, may receive their vaccine from occupational health and will be granted time off shift. So that means others on shift, others on shift, and these are off shift. For these people, they have to take on shift only. For below 17, they can take off shift. That means after their shift, they can go and take. Okay, below 17, after their shift, they can go and take the vaccination. But those who are working on shift and they are not able to attend, they are not able to attend because of their due to shift rotations. Okay, they are unable to attend an appointment because of shift rotations. They cannot. They cannot. So such people, what they will do? They have to do on shift, not off shift, on shift. On shift means where they are working. That means on site. So this is the clue. This is the clue for your danger zone. Okay. So this is off shift. For 17 or younger, it is off shift. That means 18 or over, it is on shift, the opposite of it. Try to understand. On shift, that means when they are on shift duty, on shift duty, that means when they are working on site. That's it. So they cannot go off shift, they have to do it on shift. Peer immunization. So I hope you understand it very clearly. They should respond electronically. That is one obligation. They should be above 18. That is another obligation. And for above 18, it is on shift. Those who cannot attend, they should take an appointment. They should apply online form. They will they should complete the online form. Then they should submit it. Then they'll get a reference number, code number. Then that you have to note it on a paper, and that you have to bring it to the appointment. Then only they'll give you. But still they cannot attend the appointment due to shift rotations. They should contact peer immunization, and that will be done on site because they should do it on shift, not off shift. Below 17, off shift. That means after their shift, they can do it. Anytime after their shift, they finish their duty and they can go and do it. But for those who cannot attend, they can do it on shift. On shift means on site, wherever they are working on shift duty, they're in on that site only. On site is equal to on shift. Off shift, okay, means off site. So try to understand how he has logically constructed the question. If you really appreciated this explanation, you can give me a thumbs up or a grading or how well you understood. So, yeah. So, how well did you understand? Yeah. Give a thumbs up. Give it a thumbs up or an appreciation mark or a percentage. How well? 0 to 100%. Whatever you learned. Okay, you lost. Nobody gave the right answer to this question. Nobody gave a right answer to this question. Why is it? Because it's a very difficult question. Yeah, it's a reading between the lines. You should understand. The answer is there off shift for 17 or younger. That means 18 or over. It is on shift, means on duty, means on site, means at the place site where they are working. That means on duty, they have to on duty, on site, on shift. They are all synonymous, which is contradicting. Off shift for 17 or younger is on shift for 18 or over. That's not given, but you have to understand from the other place. Yeah. Yeah, respond to the question. Give your sentence or a word or whatever you want today. How well did you understand? 0 to 100%. How well you understood? Just give your feedback so that we can go for more questions like this. Yeah. If this is off shift, this is on shift. That's it. That's the difference. Peer immunization means they should be immunized by their friends on duty. On duty, their friends, their colleagues who are working, they should give them immunization. Peer immunization means friends should give them vaccine. The other nurses, the other people who are, yeah, the other people who are there along with you on duty, they have to give you immunization because you did not take. Your friends will give you, your colleagues will give. Peer means same age group, same work group, same colleague group, the people who are working on your ward, in your hospital, or whatever it is. That is peer immunization. Answer is there here. Peers means working people, those people who are working with you, same group, same ward, same hospital. That is the point. Yeah. So here it is. Peer immunize. Peer means the peers, the people whom you are working with will be on your site. On site. Remember that one. On site. 18 and over on site, which is co-parallelly related to off site. Okay. That's it. That's not given, but you have to understand. 17 or younger off shift and 18 or over on shift. On shift means on shift duty, there itself you have to take. On duty you have to take. Where you are working, there only. Then who will give? Your peers will give. Your peers will give. Your same colleagues will give. That is the clue. Hope you understood very clearly. Yeah. Print a screen. Yeah. Yes. Print a screen. Full screen. The explanation. Simon sir is giving you a free session. Many of the students are attending. You people don't even want to give a message that you liked it or you did not like it, or you want more explanation, or how will I know that? Uh, Even a comedian, no, when a joker makes a joke, you will clap your hands. But somebody is a teacher and trying to enlighten you with a lot of wisdom, you don't even want to comment. Uh, is that how you repay your teacher who is explaining you with a great dedication and seriousness, giving his time and a free opportunity for learning? Is this how you respond? That's not fair, right? So please respond properly. I have got two response. It's not for me, it's for yourself. Damayanti. Yeah, Damayanti has given. Yeah, fine. Akshaya, Santi, three responses. Others, they're silent. That's okay, fine. We cannot expect great things from everyone, right? Yeah. So fine. That is one question. Next one. So next question. So those who are not responding and those who are not participating will not be entertained in the part C session. Okay. They will not be entertained in the part C session. Even when you come, you will not be allowed to enter the sessions. So please respond and let me know that you are serious. I don't need anything. You will be benefited. Yeah. So next, second question. That is second question. Yeah. So that is first question. Yeah. Have it done on site. Yeah. Next, we'll go to 7 page number. Yeah. Second one. This is part B. Oh, sorry. View full screen mode. Yeah. Oh. Yeah, this is the second question. Yeah. This is the second question. Function print screen. Yeah, this is the second question. Full screen. PowerPoint. Yeah. Change picture. Change picture. Yeah. So we have second question. Yeah, we have 2 minutes for this question. We have 2 minutes for this question. Boomerang 2. Yeah. Yes, 2 minutes. Ready. Here your time starts. Bottom right, bottom corner is the timer. Yes, 60 seconds more. Yes. Submit your answers, please. Submit your answers, please. Boomerang 02. Submit your answers, please. Yeah. Submit your answers. Yeah. Submit your answers, please. There is one answer. Good, two answers. Yeah, three answers. So C is there, B is there, A is there. All the three answers are come. So that is the level of confusion. What about the others? What about others? I'm giving you 10 more seconds. Yeah. So let us check the answer now. So part B. Hmm. Yeah. So the answer is a C. Disturbances should be kept to a minimum. C. Disturbances should be kept to a minimum. Yeah. A, B, C. Yeah. So disturbances should be kept to a minimum. So that's the point. Disturbances should be kept to a minimum. So update your scores. How many you got? 1 by 1 or 2 by 2 or 0 by 2 or whatever it is. Update your scores, please. Update your scores, please. Yeah. Update your scores, please. Update your scores, please. Fine. How many marks you got? These are the difficult level of questions you can understand. Okay, so learn, attend, learn things. Just by giving the answers, you may not get the right answer. So no problem. I'm there to teach you. But be patient and learn. What about the others? The others are not participating? Yeah, nobody's participating. Then why should you stay there? Huh? I don't understand. Okay, fine, no problem. Yeah, disturbances should be kept to a minimum. Disturbances should be kept to a minimum. Okay. Yeah. Who gave the answer C? That is Akshaya. Hello, Akshaya. Can you explain who is this AI? AI is artificial intelligence or what? Can you please tell me your name? I'm naming you as first, second. Yeah. You can give me your name, please. Yeah. Akshaya. Okay, you are on duty. Okay, fine. You said you are on duty. That's right. No problem. So now let us check this one. Hmm. Let us see. The guidance for administering medication in care homes states that. Okay. Now let us check this point. The guidance, okay, for administering medication in the care homes. Medication in the care homes. Okay. So medication in the care homes. Okay, medication in the care homes. Okay, fine. States that, is it talking about timings? Should be strictly observed. Highly qualified staff. Is it talking about the staff? Should be employed. Disturbances, or is it talking about disturbances? What exactly is it talking about? Timings or staff or disturbances? Timings or staff or disturbances? Staff should ensure that when required, okay, the carer prescribed and pharmacist should agree with the resident. Avoid busy. Where is staff? Where is timings? Where is disturbances? Let us see. Okay, right. Most suitable time for administration. Most suitable. Should agree with the resident the most suitable time for administration. Avoiding busy periods where possible. Okay, avoiding. So avoiding busy periods where possible. In order to avoid, see, avoiding something. So this word is repeated, avoiding. Avoid, in order to avoid disruptions during the medication round, planned staff break should not be scheduled, and more trained and skilled employees could be put on duty. The administration time could also be reviewed. For example, administering once daily medicines at lunchtime rather than in the morning if clinically appropriate. Health professionals visiting the home to give residents medicines should make their record of administration available to the care home staff if requested. So here you can understand very carefully. Is it appointment? So it's nothing talking about appointment. Highly qualified staff should be employed. So highly qualified staff should be employed. Skilled employees should be there. More trained and skilled employees could be put on duty. Try to understand. More trained and skilled employees could be put on duty. It's not okay. It's on duty. It's talking about duty. Okay, not appointments. It's talking about duty. Untrained employees remove and trained employees you put who are already employed. Okay, untrained employees and trained employees. They're already employees. Trained and skilled employees already employed. So should be employed means for future. Okay, try to understand it. So it is not about employing staff. Okay, already employed. Trained and skilled employees, those who are already recruited, should be recruited. Employed means should be employed means should be recruited. That means now we don't have should be recruited. So here he's telling, and more trained and skilled employees means already they are employees. Instead of untrained and unskilled employees, put trained and skilled employees. That is what he's telling. Okay. So try to understand that. So B is ruled out. B is ruled out. Highly qualified staff should be employed. Okay, that's what it is. So skilled employees and skilled, highly trained. So next one, timings should be strictly observed. Timings should be strictly observed. Where is telling timing should be strictly observed? Okay, timing should be maintained, but staff should ensure that when required, medicines are kept in their original packaging. The carer, prescriber, and pharmacist should agree with the resident with the most suitable time for admission. Suitable time. Whatever suitable time should be observed, not strictly 8 o'clock means 8 o'clock. No, for example, yeah, little before or after also is okay. Suitable time. Say strictly observed means morning, afternoon means afternoon, evening means evening. Morning 8 o'clock, afternoon 12 o'clock, evening 4 o'clock, like that. No, not strictly. So suitable, which is the more suitable time? For example, the patient gets up late. So instead of 8, you can give it 9 or 10. What's the problem? Okay. So suitable, which is the most suitable time for the patient? that time you have to give the medication. Okay. If the time is not suitable, so take a suitable time. Whether it is suitable to the patient or not, you must give, means 8 o'clock means 8 o'clock, you must take. How it is so rigid rules? Okay. So suitable time, most suitable. Pharmacist should agree with the resident, with the patient. Okay. With the resident who is there. So they should agree. If the patient agrees, then only he will take. If he doesn't agree, he will say, no, get lost. I don't want your medication. That's it. If you want to give exactly at 8 o'clock, I don't want it at 8 o'clock. It's better for me at 9 o'clock. If you want to give at 9 o'clock, give. Otherwise, get lost. Okay. The carer means the person who is taking care in the medication care home is the carer. Prescriber means doctor and pharmacist. All of them, three, should agree with the resident. The most suitable time for administration. It is not according to the carer, it's not according to the prescriber, it's not according to the pharmacist. It should be agreed with the resident. The resident should say yes. The consent of the resident is more important. Why? Because if he wants only, he will take. Nah? The most suitable time for administration. If it is unsuitable for him, he'll say no. And if you are doing something at that particular time when it is not suitable for him, that means you are disturbing him. You are troubling him. You are irritating him. You are making him upset and angry and worried. Because you are the reason for the problem. Okay? You are the reason for the problem. You should understand that. So, there should not be too busy periods where possible. If it's a very busy, it's not comfortable for him. He has to wait for you. Okay? He has to wait for you. You're very busy, right? So that time is not suitable for him. And next one, disruptions during medication round. Planned staff breaks should not be scheduled. Okay? Staff breaks. Okay, which are breaks, that time you should not give, because then nobody will be there that time, and more trained and skilled employees could be put on duty. The administration time could also be reviewed. For example, one day it is not okay, another day you can change. Administering once a daily medicine at lunchtime rather than in the morning if clinically appropriate. So you can review. Instead of giving in the morning, you can give it lunchtime. Okay, you can modify. If the patient is comfortable at lunchtime, give him at the lunchtime instead of morning. Daily once only you have to give. Instead of morning, you give in the afternoon. What's the problem? No, morning means morning. No. Schedule him every afternoon only. What's the problem? Okay. What's the problem in that? So be careful. So could also be, for example, administer once daily medicines. Once daily medicines. Why in the morning only? So rather than in the morning, give it in the lunchtime. If clinically it is appropriate, it's okay. If clinically there is a problem, then don't give it. For example, yesterday evening only he has taken. Okay, today morning he has taken, so afternoon he can take. But yesterday evening he has taken, and again afternoon it's not. So again in the evening only you have to give. So 24 hours schedule, na? Within 24 hours you should not give. Again another dose. You take one medicine in the evening, and the next morning is not 24 hours. Okay. Should give one dose and another dose, difference between it should be at least 24 hours. That's the time schedule, nah? Right? Yeah. So you can understand here very clearly. You should avoid disturbing the patient. You should avoid problems to the patient. Patient should agree. You should not disturb his routine. He should be happy. If you disturb him, he will not be happy. Medications in care homes states that It's talking about not the timings should be strictly, timings can be altered. So timing should be strictly, so now let us see here, danger zone. I'm explaining each and every point here now. Where is this? Red color, I want to change the color. Yeah. Now, red color is the wrong answer. How it is wrong answer, I'm going to show you now. Yeah, see here. Timings. Timings here. Times could also be reviewed. So how can you say it is? Timings could also be reviewed. Then that means it should be strictly observed. If it is strictly observed, that means you cannot review the timings. 8 o'clock means 8 o'clock only, standard rule. But he's telling no, timings could also be reviewed. For example, instead of morning, you can give in the afternoon, no problem. Because in the morning also, yesterday morning he took, he's telling I cannot take in the morning. Then you can give in the afternoon because 24 hours elapsed. Instead of giving in the morning, you can give in the afternoon. So again, next day afternoon you can give. But you cannot give in the morning because afternoon to morning is not 24 hours. You can give in the afternoon or you can give in the evening. So at least between one medication dose and another medication dose, there should be 24 hours. That's the rule. Okay. So timings should be strictly observed. No, timings should be strictly observed. No, this is wrong because timings could also be reviewed. So B is ruled out. Sorry, A is ruled out. A is ruled out because timings should be strictly observed. No, timings can be reviewed. Timings must be strictly observed. No, timings can also be reviewed. Means they can modify. They can be changed. A is wrong. A is wrong. So I hope you agree with what I'm saying now. Now, highly qualified staff should be employed. Should be employed. That means now there are no qualified employees. There are unqualified employees. That is the meaning. Or less qualified staff. So highly qualified staff should be employed. That means there are no employees or less qualified employees are there. So you should employ, means recruit highly qualified staff. Okay. He's not telling to employ because they're already employed. See here. They're already employees. And these employees could be put on duty. Okay. These highly qualified employees can be put on duty. He's not asking to recruit, but already highly qualified employees are there. Put them on duty, he's telling there. Okay. So more number of trained and skillful employees could be put on duty. Okay. More trained and skilled employees could be put on duty. He's telling. He's not telling you to employ somebody else. Already employed people only he is asking you to put more trained and skilled employees. Not highly qualified staff should be employed. Already employed, those you put, na? Okay. It's not a new employment. Not this is new employment, but this is old employment. Employees, already employees. Already employees, they cannot be employed again. Okay. So put on duty the already existing employees. Employees are already there. See, employees already there. Here, employees are not there, so you should employ them. So B is ruled out. Already employees are there, put them on duty. Skilled and trained employees, put them on duty. That's what he's telling you here. Yeah. Next one. Disturbances should be kept on to a minimum. Avoid busy periods. Busy periods. Disturbance. Busy period is a disturbance. So avoid means keep it a minimum. Should be kept to a minimum means avoid. Okay. Avoid disruptions. Disturbances. Okay. I'm putting this color in green. Okay, 1 minute. So should be employed. No, employees are already there. Okay, should be employed. Already employees. Okay, they are already employees. Need not be employed because they are already employed. Skilled employees are already there. So put them on duty. On duty. Okay, right. Next one. Avoid means reduce. Sorry, green color. Na? Correct answer is the green color. Yeah. Should be kept to a minimum means avoid. Should be kept to a minimum means avoid. Disturbances means disruptions. Disturbances means busy periods. Busy periods are disturbances. Avoid busy periods. So disturbance, reduce. Avoid these busy periods because that is a disturbing period, troublesome period, irritating period. You should reduce that. Avoid it means reduce. Keep it a minimum. Avoid disruptions. Avoid means keep it to minimum as much as possible. Okay, avoid totally or as far as possible. If you cannot avoid, it's okay, but you have to avoid them. That means as less as possible. Disturbances means disruptions. Yeah, disruption means confusion, chaos is nothing but a disturbance. Okay, busy periods is when something is very busy area, it's a disturbance. You feel irritated with that. Okay, so this is how you're going to select your option. Okay, avoid means should be kept to the minimum. Disturbances, busy period is a disturbance. If you want to give medication when there are too many people, that is a disturbance. And disruption, suddenly something comes, disruption. Okay, you're teaching a lecture, suddenly somebody comes, it's a disruption, it's a disturbance. Okay, agitation, confusion, chaos is disruption. So this is how you will select your answer. So C is right. Avoid means reduce as far as possible, bring it to zero, or as far as possible less, minimize. Minimum means minimize. Avoid, if you avoid means minimize only. Na? Disturbances, busy periods are disturbances, disruptions are disturbances. So how far you appreciate this explanation? Okay, yeah, give your feedback. If you like it, you say why you like it. Give a thumbs up or some emoji or something so that I can understand that you understood. I don't need your appreciation, but I need to know that you understood. And people are not generous enough even to let me know that they understood. I feel very sad. Yeah, yeah, here is the option. Copy post link. Oh, 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 oh. Yeah, yeah, thank you very much for your feedback. I really appreciate this. So here is the link. You go there, click it on that one. You will go to Telegram channel. And then, so today is an all day. Today is an all day reading. All day reading. I'll give you as many sessions as possible. But please respond. Otherwise, I'll get irritated and I'll stop teaching and I'll just go and relax. Why I should be, those who don't even want to respond to tell me that they understood something, for them, why I should spend my time so much? Yeah. So, yeah, Jay, very good. Thank you very much. Akshaya, thank you. First, second, your name, please. Who is this first, second? Yeah, Manjula Hemanti, thank you. Yes, some method to tell me that you understood. First, second, your name, please. I'm asking your name, please. Your name, please. Sir is asking, please give me your name so that at least I'll know who you are. No? Yeah, name, please. At least type your name or tell me your name. First of all, many times some people will come and put something on the screen and they'll leave off. That's why I'm asking. Your name also said artificial intelligence, AI. So that's why I'm asking you. Okay, right. No problem if you tell your names. I need to know who is studying. Na? Yeah. So we got a few candidates who have responded. Thank you very much for your response. So Akshaya, first, second, Damayanti, Suranga, Anagipura, Manjula, Hemanti. Yeah. First, second, I'm giving you another 5 minutes to give your name, okay? Then afterwards, don't blame me. So now, shall we move on to the next question? Third question. Shall we move on to the next question? Yeah. Shall we move on to the next question? Yeah, first, second, left. Very good. No problem. No need. Those who don't even want to show their names, why they should stay on our platform? Yeah. Next. Yes. Come on. So are you tired or do you want me to continue with the next question? Respond, please. So third question. Yeah, this is the third question. Yeah, this is the third question. Yeah. Function print screen. Full screen. Yeah, Boomerang 3. Boomerang 3. Yeah. Yes, get ready for the third question. Get ready for the third question. Yeah. So third question is here. 120 seconds. Yeah, 60 seconds more. Yeah, I'm giving another 60 seconds. Yeah, submit your answers, please. Submit your answers, please. Yeah, so B, 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 C. So majority is B. Okay, let us check our answer now. So 14. The answer for this question is here. B is the right answer. B is the right answer. Update scores, please. Update scores, please. Update scores, please. Yeah, B is the right answer. A, B, C. Logical reasoning approach. Yeah. So 3. B is the right answer. Inform physicians about a new form of assessment. That is the right answer. Okay. What you can do is copy post a link. You can just go and click a bubble on the bubble. Click on the bubble here so that, okay, you'll know how our operation system is working. Yeah. Now, let us check this one. How we are going to explain this question. Right. So many have given the answer. Who is, anybody is interested to explain? Rania. Alzheimer. Rania Alzaki, welcome for the start platform. Rania Alzaki. Okay, right. So there are new students also are attending the sessions. I welcome you all. So Akshaya is one. Then Suranga Anagipura is another one. Yeah, welcome you. So anyone wants to explain this one? Sarah, do you want to explain this answer? Who wants to explain this answer? Anybody? Anyone who wants to explain this answer? Yeah, who is that? Sarah. Okay, Sarah, I'm unmuting you. Sarah Ampofo. Yeah, Sarah, Sarah.
Hi, sir. Good morning.
Good morning, dear. Yeah, you can explain. All the stage is yours.
Okay. So when we will look at the question, it says that the purpose of the meal is to do what?
Mm,
So when you look at the subjects, it says diabetic eye screening.
mm,
So when you are screening somebody, you are doing assessments.
mm,
Okay. So when you read the first paragraph and the second paragraph, it is just giving out an information
mm,
about how a new screening should be done.
mm,
So it's just giving guidelines when a patient can do that, do that. So
mm,
I picked my B from the second paragraph. It says that
mm,
the screening is straightforward and then it takes approximately, so it's just giving you a guidelines about how a new introduction of something should be done.
mm,
So it wasn't a new clinical procedure that was being given. It
mm.
wasn't an update of any details, but rather it was a new form of assessment. So it's just giving it's throwing more light to how an assessment should be done. So that was why I chose B.
Okay, very good. Now coming to the point, yeah, you can mute back. Update details given in an earlier message. So here, earlier message. Now let us break this one into three different zones. We call it time zones. In an earlier message, he is referring to an earlier message. Earlier message means past. Earlier message means this is past. Okay. This is, you can say, past. Past one. He's referring to the past. Inform physicians about a new form of assessment. New one. That means present. New one is present. Explain when a new clinical procedure will be available. Will be available is future. So he's actually quoting to past, present, and future. You should understand that. A new form of assessment, that means you are assessing, it's a new form, and you are assessing, that means already existing. A new form is present. A new form is present. And here, a new clinical procedure means present only, will be available means future. So this is past, an earlier message, earlier past, new form. Here no earlier, no will be available. So it is present, will be available is future. So try to, this is already available. Inform physicians about a new form of assessment because it is already available. And this is will be available. Already available means present. Before, earlier means past. Will be means future. So this is how you are grading it into three time zones called past, present, and future. So is he telling about the past, or is he telling about the present, or is he telling about the future? So in the entire paragraph, there is nothing called will be. there is nothing called will be. It's nothing about future. It's nothing about future here. Okay? It's nothing about future. There is no word called will anywhere. You see there. Everywhere it is are, is, not were. With no future word there. You can see, just simply if you see, is. Okay, not was, not will be. Okay, ensuring early treatment and prevention of the, okay, primary carers should refer to all patients who have a confirmed, should refer in the future, but not here. Okay, have a confirmed diagnosis. Primary carers in the future should refer all patients to have a confirmed diagnosis of diabetes mellitus for screening. This is just a referral, but screening is already there. Okay, those meetings, they should refer because it is already there. It is already there. Screening is already there. So that should, in future, they should refer. Those meeting the criteria will be invited because for retinopathy screening, because it is already there. They will be invited because it is already there. If it is not there, they will not be invited, right? So try to understand that one there. Within 3 months of registration, to ensure equity of services, very great word, equity, not equality, equity means according to requirement. Clinics are arranged, see present tense, are arranged as close to the patients as possible. The screening is straightforward. He's talking about screening. Screening is, not will be. Patients should be referred. Carers should refer. That is future. Carers should refer is future. But the service is, screening is, clinics are. See, everywhere it is present tense. Primary carers should refer. That is future. That's different. Because it is already there. Screening is already there. Primary carers should refer. If a hospital is there, you can refer the patients there. If the hospital is not there, then how can you refer? Okay. So, this is an order, not the state. The next one, here. And it takes, screening takes present tense. Following my dear, say photographs of the retina are obtained, see present tense. Using images are then sent, present tense. And severity of, if sufficient levels are present, the patient will be referred. If they are present, then the patient will be referred to ophthalmology for further assessment. For the present assessment, no need, it's present. Future further assessment is future. Ophthalmology further assessment. But this screening, diabetic eye screening is present. Ophthalmology for further assessment, not present assessment. Further assessment is future, but present assessment is present. So everywhere you can see are, is. That means present tense. So it's very clear. The entire paragraph is talking about present tense with regard to screening. Screening is present. Everywhere screening is. Screening is. Clinics are. Service is. Service means screening. The recently introduced service is nothing but diabetic eye screening. This is diabetic eye screening. This is the service. This is recently introduced. It is designed, so it is present. The screening is, the screening, diabetic eye screening. This is the present service. Okay, is. So you can understand everything is in the present tense. So because of this tense format, B is the right answer. B is the right answer. Then there is next no word called was, were. Nothing is there. So updates given in an earlier message means was given, were given, was given, were given, had, or something will be there, but there is no past tense. So A is ruled out according to this theory. Will be available. Screening will be available. No, screening is already available. Screening is already available, is introduced already. Recently introduced, it's already there. Recently introduced, it's already there. Okay. Screening is, and it is takes 40 minutes. That means it's already, you are telling them to do all this. So it is talking about a procedure, a new form, about a procedure, about a procedure, about a procedure of this assessment. Procedure of this assessment. Diabetic eye screening is an assessment. Okay. You're testing him, you're assessing him, you're examining him, you're evaluating him. Okay, and this procedure takes 40 minutes. What you are telling about the time, you are telling about the steps, you are telling about the measures, you are telling about everything involved in this process or procedure, one by one by one by one. Okay, what you should do, what you should not do, everything is explaining about this new form. New form means recently introduced, old form means in the past, earlier. But okay, past, no, it's not past. Recently introduced means present, the new form. So new form, recently introduced, okay, long back means past, recently means present. Remember, recently introduced. Okay, so it's a new form. Okay, this has been introduced recently. Okay, not earlier. It's past. Earlier is past, recently is the present. New form of assessment. So you can understand new form. How do you know that it is new form? Recently introduced. New form. New form means recently introduced. Assessment means screening. Diabetic eye screening is assessment. About means regarding. Regarding, designed to do what? To do what? And how much time it takes. Okay, for how much time it takes, what you should do, when you should do, how you should do, what is the assessed assessment, you can see here. Okay, images are then assessed, images are then assessed, so assessment. So everything it is detailing you very, very clearly. It's assessing very, very clearly. How well did you understand? Give me a word or an emoji or a statement or a sentence that you understood very well. Don't need to appreciate that you have explained very well. I don't need any appreciation. I just need to know how well you understood. Okay. So please let me know how well you understood. Yeah, that's it. So that I can give you even another explanation. If you don't understand, I have to give you another explanation. That's the reason why I ask you the explanation. So two different ways I have explained you here: past, present, and future. And new form means this recently. Assessment means assessed. Procedure, form, about means procedure. Okay, system, how, do's and don'ts, everything about regarding. Okay, yeah. Thank you, Sarah. Thank you, Akshay, and thank you, Damayanti. Nishad Banu, thank you. So that you made me understand that you understood the session well. Others maybe they did not understand well. So if you did not understand very well, please openly tell that you did not understand or you want an explanation. Share that one. Being silent will not help you, will not help me. Yeah. So 3 questions over. Yeah, next, fourth question. Fourth question is here. Yeah, shall we go for the fourth question? Shall we move on to the fourth question? Give me a yay or a nay. Yeah. Yeah, thank you very much. Rania. Rania. Yeah. Next, Irandi Nilushika, welcome to the platform. So we are moving to the next question. So here it is. View full screen. Yeah, this is the fourth question. $175. Yeah. Yeah, that is the question. Ha 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 ha. Okay. Function print a screen. Full screen. So what we can do is go to our presentation and two. Yeah. Print screen. Full screen. Yeah. So we have the next question here. Yeah, 120 seconds, please. 120 seconds. Hide floating meeting controls. 120 seconds. You can submit your answer, please. Submit your answer, please. Submit your answer, please. Yeah, 7 students have given the answer. Very good. Very good. Yeah, that's very good. So 7 students have given the answer and most of them are A, 1B. Okay, let us check. Yeah, 14th question, fourth question. Fourth question is A, A, A. Fourth one is A is the right answer. So Boomerang 4. Yeah. Quiz mode A, B, C. So A is the okay logical reasoning approach. Logical reasoning approach. Yeah. So that answer is A. Yeah. So update scores, please. How many marks you got? Out of how many questions? Update scores, please. Yeah. So Rania. Hello Rania, how are you? Can you introduce yourself, please? Yeah, there is somebody with a 3 dots. Who is this 3 dots? Can you write your name, please? I'm naming you as first, second. I don't know who you are. Can I know you? Write your first, second names, please. And Suranga Anagipura. Hello, Suranga. Nice name. Suranga. Can you introduce yourself? I know you are from Sri Lanka. Yeah. So you can just message. So first, second is Ahmad. Very good, Ahmad. Ahmad, where are you from? So first, second. So rename Ahmad. And the second name is missing. So I'll write second. Okay, fine. So Ahmad, you can tell about yourself. I'm unmuting you. If you're comfortable, you can tell where are you from. Welcome to the platform, Ahmad. Or if you, yeah, I am Dr. Rania. Dr. Rania, this Dr. Rania, I think I know you. Is that right? Dr. Rania. Dr. Rania. Rania. I think I know you. We talked earlier. No results for Rania. Do I know you, Dr. Rania? Yeah, you attended the session once before. Okay, very good, very good. Yeah, so nobody's talking. Okay, no problem. We'll go ahead. And now we'll discuss this particular question. Right. Yeah. So D is a Rania El Zaki. Yeah. All right. I pronounce your name correctly then. All right. Yeah, now we'll go to the question here. This is the question. Okay. Now let us take this one. Color blue. The notice says that if the medicine refrigerator is not working, if means a condition, the medicine refrigerator not working. The medicine refrigerator is not working. Okay. The medicine refrigerator is not working. Not working. So if means in the event of. If means in the event of. If means in the case of, in the event of. Okay. If means in the case of or in the event of. The medicine refrigerator, this refrigerator not working, breaking down. Okay. Okay. Answer is very clear there. So that's why answer is very easy for you. Prompt arrangements for its repair. We don't bother about repair or not. We are bothered about medicines. So medicines is here. We are not bothered about the refrigerator. We are bothered about the medicine. Medicine refrigerator. Medicines bothered. Now what should we do with the medicines? Medicine should automatically be placed in a bag and they should be marked. Do not use. Just mark blindly. Do not use because medicine refrigerator broke down. So do not use. When there is a breakdown, when the refrigerator stops working, these medicines by default, they become redundant, unnecessary, waste. They cannot be used. That means that is it. Clear it off. It's cleared. They should be placed in the bag marked do not use. That means should not be used. Should be placed in a bag and marked and do not use. Okay, that's it. So they should not be used. That's the meaning. They should be put in a bag which is marked do not use. That means they should not be used. And transferred to another medicine refrigerator if available, because they are quarantined. Okay, it's not for use, it's do not use. You put in another medicine, another refrigerator also, but they should not be used because we already labeled them to not use. Okay. If no other refrigerator, quarantine. And don't let that be next to the other usable things. Don't put it in the same refrigerator or keep it somewhere else. That's all. Remove all these things and put them do not use. Okay. There is no need to check and find. There is no blindly do not use. Put them in the do not use bag. That means clear instructions are given. They should not be used. So put it in do not use and put it in the bag which is marked do not use. That means it's very clear instruction. You need not check, you need not test, you need not assess whether they are usable or non-usable or whatever. Nothing doing, zero doing anything else. Just close your eyes, put them in the bag which is labeled do not use. That's very clear. Okay. There is not working. There is a need to establish. Okay. The notice says that if the medicine refrigerator is not working, there is a need to establish whether the contents may still be used. So now, just use it there. You don't need to establish. You don't need to check. You don't need to do anything. You just put it in a bag. Just put it in a bag and transfer it to another medicine register. Refrigerator if available. If not available, the medicine should be quarantined and kept separate from the rest of the contents. If no alternative refrigerator is available, quarantine the medicines as above and leave the medicines in the malfunctioning refrigerator with the door closed. Leave it in the same place and close it off if no other refrigerator is there. Quarantine the medicines as above and leave the medicines in the malfunctioning refrigerator with the door closed. Note the maximum and minimum temperature displayed on the refrigerator and check the monitoring form for when the refrigerator was not last working properly. Try to ascertain how long the medicines have been stored outside of the required temperatures. Record the drug and manufacturer's name and attempt to find out if the medicines are still safe to administer. Contact the medicines management team for further advice. So what you have to do is, you are not going to use. You don't know how to use it. You cannot establish. So what you have to do is, you have to label it like that, put it in a bag, and then keep it in the same refrigerator, which is not, if there is another refrigerator which is working, put in the working refrigerator. Otherwise, quarantine them and put it somewhere else, but don't keep it in the usable area. Otherwise, put it in the same refrigerator and put everything, and when it stopped working, mark it everything and send all these details to the manufacturer. Okay. So try to understand how long the medicines have been stored outside of the required temperatures. Note all the details and record the drugs and manufacturer's name and try. Here it is the word last. Okay. Attempt means try to find out if the medicines are still safe to administer. So here is the word. So there are two layers here now. The first layer in the beginning, if means in the event of refrigerator not working, means breaking down, means breakdown, then medicines you should not use. Do not use. And then what you have to do is, there is a need. That means you have to try, attempt to establish, means find out, whether means if, the contents means the medicines may still are still be used, safe to administer. See, everything is there. Everything is there. Okay. There is a need, means try to establish, find out, to establish whether means if means in the event of, remember all these words. Whether means if means in the event of, the content means the medicines. Okay, may means are, still means still be used, safe to administer. So everything is clear. Have you got the clarity? First is telling, put it, do not use. Okay. Until it is established, do not use, and find out whether it can be used. And then if they say it's okay, then you can use. Otherwise, you have to send back to the manufacturer. Okay. That's the point. Yeah. So this is how we are going to find the answer. So give your comments regarding this question explanation. How well did you understand? Was that clear for you? 100% or 0% or 50%? Or what did you not understand? Is it ambiguous or confusing? So the explanation. Yeah. Thank you very much. Ahmed is from Kashmir. Wow. Ahmed, give your feedback whether you understood or not. Yeah. Fourth question over. Now, shall we go for the fifth question? Shall we go for the fifth question? Yeah, give me your response. I need fast response. Okay. Shall we go for the next question? Fifth question. Yeah. Fifth question. Fifth question. This is the fifth question. Yeah. This is the fifth question. Boomerang 5. Yeah. So you have 120 seconds. The timer is at the bottom left right corner. Bottom right bottom. Bottom right corner. Yeah. So right. 120 seconds from now onwards. Submit your answers, please. Submit your answers, please. Submit your answers, please. So after this, there will be listening part B. Listening part B. This is the fifth question, and there is one more question. After that, there will be listening part B. How many of you are there for listening part B? If you are interested, say listening dash interested. Okay, just copy paste this one also, no problem. Listening dash interested. So I just want to know how many of you are interested. So for them, I'll send the link. Okay, listening interested. Next is listening part B. Next is listening past part B. Yeah, those who are interested, say listening interested. Yeah, I'm giving na Sara. Reading, reading I'll give, but listening also I should give na. Huh? There are students who have registered for listening only. Yeah. Yes. I'll give you more. Don't worry. Yeah. So submit your answer. Yeah, you have answered C, C, C. And there are some A's. 1, 2, 3, 4 C's and 1, 2, 3, 4 A's. Okay. Yeah. So now let us check this answer. So 14, page number, question number, reading B5. 5 is C. 5 is a C. A senior member of staff should be informed. 5 is a C. 5 is a C. Okay. 5 is a C. Okay. A, B, C. So logical reasoning approach. Logical reasoning approach. Yeah. Logical reasoning approach. So this is the link. Copy post link. Yes. Now let us check. 5 is a C. Yeah, you can see here. The exact from the guidelines tells us that as soon as the patient is confirmed missing, what should we do? Okay. What are we supposed to do? The extract from the guidelines tells us that as soon as means immediately. As soon as means immediately. A patient, okay, is confirmed missing. Then what should we do? So missing patient procedure. So procedure means what should we do? Patient. This is all about this one only. So these are guidelines. Okay. Now let us relate these two things now. Okay, confirmed. A patient missing. Okay. Procedure, guidelines to do is the procedure. What are the guidelines? What is the procedure? What should you do? Immediately. Immediately, what should you do? Immediately. As soon as means what should you do? Immediately. Okay. Immediately means initially. Okay. Initially. What should you do? There's a point in there. Okay. Immediately means initially. Okay. What should you do? The entire site should be checked. The incident guidelines means procedure. The incident shouldn't be recorded in the log. A senior member of staff should be informed. Okay. Now, if a patient is thought to be missing from an area, okay, right? Staff must initially and quickly ascertain means confirm. So confirm. Ascertain means confirm. The word is here. So not after missing, first you should confirm. After this one, what you should do, after confirming what you should do, not after missing, it's after missing you should confirm. After confirming, as soon as the patient is confirmed. So now try to understand this. First he is missing, then you are confirming. But here the question is asking as soon as the patient is confirmed missing, not missing, confirmed missing. First you should confirm that he is missing or not. After confirmed missing, then what you should do? Okay. Then what are you supposed to do? Yeah, that's the point. Uh, what are you supposed to do here? That's the point. So ascertain whether the patient is attending another area of the hospital for treatment, or whether they are with a relative or care. This is your ascertaining, means you are assessing, you are confirming. The care plan should be consulted in order to establish factors likely to increase the patient's vulnerability and known risk for the patient. That means here you are confirming in the first paragraph. The search log should be consulted in order to ensure that all areas are formally investigated. A thorough search of the ward and department must then be undertaken to ascertain whether they have inadvertently been detained in a different room or area. That means you are confirming still. Once a patient is believed to be missing, that is confirming here. Ascertaining means believed to be missing, confirming. So here you have to notice, here is the answer. Once means as soon as a patient, okay, is believed means is confirmed to be missing. The worst case scenario must be assumed and the missing patient procedure initiated in the ward department manager on duty. Ward department manager on duty must be alerted immediately. So the answer is here. And the question also is here. I'm giving it a red color because black we already used. So once means as soon as a patient to be missing is confirmed, is believed. Finished. Question part is finished. Then the ward department manager is a senior member of staff. Should be, must be informed, alerted immediately, as soon as. Okay. Hope you understand the sequence, right? Yeah. A senior member of staff is the ward department, ward manager or department manager, whoever is a senior. Okay. If ward number is there, you tell you the ward number. If the department manager is there, tell the department manager on duty. Okay. On duty, not off duty, on duty. Should be, must be. Should means must only, na? Informed, alerted. Immediately, as soon as. That's the point in there. That is the point in there. A senior member is a department or ward manager. Should be is must be. Informed, alerted. Immediately means as soon as. Smita's iPhone. Smita is coming in the last minute now. Smita is busy, I think. Hello, Smita. How are you? Smita from the United Kingdom. Very good. At least you are there. Thank you. Okay. Now, try to understand this. As soon as means immediately. Okay. Confirmed means believed. Once means as soon as, at that particular time, immediately. Okay. Once you reach there, call me. That means after going there, immediately call me. Means very same minute. That's the point in there. So that is the explanation to this wonderful question, my dear students. Just at least after explaining for so much time, give your comment on how well you understood. No need to appreciate me. Just let me know how well you understood. Please. I should know whether my explanation is useful or useless. Na? Correct? Okay, you are making me clueless whether my lesson is understandable to you or not. So how do I know whether I should give more of such sessions or not? Yeah, comment please. Give your valuable feedback, whether you understood or you did not understood, or what did you feel difficult. If you did not understand, let me know that you did not understand. You need further explanation why. You can tell me at least a word or a sentence, whatever. Okay, my explanation is just like, in our India, they will put cow dung to the wall. That means it will not come back. Cow dung to the wall. They will be used as a, for fuel for cooking in the villages. Cow dung. They'll burn it. Okay, but if you tell me something, then if it is used, if you tell me, then I can think of telling more sessions like this. Say, because many students are participating, I'm thinking of giving a listening session immediately after this. Yeah. So shall we go to the last question, sixth question? Yeah, 3 students have given the comments. Thank you very much. Rania, Alzaki, and Akshaya, Nishad. Very good. 3 students. Thanks. Shall we go on to the next question? A yes or a no? So only 3 students are seriously attending the class. Very good. That's very clear now. Next one. We'll go to the last question. Yeah. Sixth question. Yeah, this is the sixth question. Boomerang 6. Yeah, last question. Yes. Yes. 60 seconds more. Submit your scores, please. Yeah, submit your scores, please. Submit your answer, please. Yeah, C, 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 B, B. Yeah. So there is a tie up between 1, 2, 3, 4 C's and 3 B's. Yeah. Let us check the answer now. A, B, C. Logical reasoning approach. Yeah. 14. Sixth question is a C. Sixth question is C. Yeah. Now let us check how C is the right answer. How C is the right answer. Let us check. The policy extract states that, what does it tell? Chaperones are usually the same gender as patient. Okay, first one is he's talking about chaperone. Okay, so chaperone is common word. You should understand that chaperone is a common word. This is about chaperone. Chaperone, chaperone, chaperone. Okay, now let us see. Chaperones are there everywhere. So now what is important then? Chaperones are usually the same gender. So he is talking about gender. A note should be made of why the chaperone was necessary. Why a chaperone was necessary. Why means need. Chaperone means why means need. Urgent treatment must go ahead even if a chaperone is declined. Urgent treatment. This is talking about urgency. So first one is gender. Second one is reason. Gender of the chaperone. Second one is the necessity of a chaperone. Third one is urgency. Okay, chaperone is declined. Okay, urgency, urgent treatment. Okay. Now, now that is very, very important. Okay. It's very, very important. It's very, very important. Now here, if a patient requires an examination involving close proximity, physical contact, dim lighting, or if the patient is vulnerable or at risk, a clear offer of a chaperone should be made. Whether the patient and doctor are the same sex is irrelevant. In this case, the risk may be reduced, but is by no means absent. If the patient does not accept, explain why a chaperone is necessary and reoffer. Although you may prefer not to proceed if you feel uncomfortable, but in all emergencies, so here is there emergency, all emergency scenarios, all emergency scenarios, emergency, every emergency situation. So there is the point here. Emergency means everything ruled out. Patient safety should override the clinician's assessment. If the clinician wants or doesn't want or whatever it is, whether the chaperone is there or chaperone is not there, the clinician likes or doesn't like, everything is not important. Patient safety is override. Override means you should go ahead. Go ahead. Because patient safety is important. Whether the patient agrees or doesn't agree, whether the clinician likes or does not like, whatever it is, saving the patient is more important, whether the patient likes or doesn't like, whether the clinician likes or doesn't like, whatever is the case. Patient safety is more important. Okay. Clinician's assessment or patient's safety is very important. Even clinician safety is not, that's important. Patient safety is very important. Okay. His or her own safety. Clinician's assessment of his or her own safety. That's not problem. So override. Patient safety override. That means patient safety is important. So go on. Don't wait. Even if he says no need a chaperone, even if he says I need a chaperone or no need a chaperone, if he accepts or rejects or whatever it is, even if he rejects, you should go ahead. Even if he rejects, you should go ahead. That's it. Even if he declines, okay, patient safety should go ahead. Although you may prefer not to proceed if you feel uncomfortable, you are uncomfortable, you don't feel to proceed, but still you have to proceed. It's not your interest, it's not the patient's interest. The patient's life should be saved. Urgent scenarios, urgent treatment must go again. Go on. Okay, go on. Clinician's assessment. Okay, patient safety is more important. So go ahead. That is the clear hint. Treatment must go on. Yeah, that's it. Now let us see here. All these should match. Okay, all of them should match. Yeah, urgent means emergency. Patient safety should override the clinician's assessment or his or her own safety. When in this case, the risk may be reduced, but is by no means absent. Risk is always there. If the patient doesn't accept, does not accept, not accept means reject. Not accept means reject. Not accept means reject. Chaperone, chaperone, chaperone. Okay, he rejects. Even if he rejects, even if means although, even if he rejects, although he rejects, and even if you prefer or not prefer, okay, right? So try to understand that everything is, so must override. Override means go ahead. Should means must. Treatment means patient safety. If you treat, patient will be safe. If you do not treat, patient will be at risk. Every word, read between the lines. The answer is clear for you. Okay, answer is clear and clear for you. Not accept means reject. Okay, treatment, patient safety. If you treat, there's patient safety. Should, must. Override means go ahead, don't stop. Go ahead, override, overtake. Whatever the condition is, you have to go ahead. That's all. Move on. Override means move on. Forget everything and go on. That is override. Ignore and go on. Do not consider and go on. Move on. That's the meaning. Override means forget everything and move on. Ignore, bypass. Forget all the things and go on. That's the meaning. So I hope it is clear for you. And that is the last explanation of the last question. So please they give the overall feedback of six questions. Six questions. Provide your valuable feedback. Provide your valuable feedback, please. Total, how many questions, how many marks? Give your scores also. Write in 1 or 2 sentences. Yeah. Thank you all for your valuable feedback. And if anybody is interested to attend the regular sessions, you can get back on my WhatsApp number. I'll give you now. You can contact me. So this is my WhatsApp number. You can contact me if you are interested for regular sessions. Yeah. So I'll give you the links. You can attend the sessions regularly. So Irandi, then Suranga, then Rania and Akshaya. You have a chance to take the regular because I have seen you regularly attending the full session. So if you are interested, you can take the subscription. You can contact me personally because last Saturday there were some students who went for exam and we have got good results also. So we are replacing the old students with new admissions. So we have places to fill. So you can contact me if you are really serious. Yeah. So select all, copy and paste. Yeah, see you all later post lunch.